All patient tubes and suction connections should be routinely checked to ensure proper leak-proof operation and chest tube patency. Like all Atrium models, the Express 4000 single-drain collection chamber incorporates a large writing surface with big, bold numbers and easy-to-read fluid level graduations. The first collection chamber column is calibrated in small 1 ml increments up to 100 milliliters in brightly colored bold numbers, then in 2 ml increments up to 200 milliliters. Subsequent collection chamber columns are calibrated in 10 ml increments up to the maximum drain capacity of 2100 milliliters. The Express 4050 blood recovery model, with its large capacity blood clot filter, meets today's needs for a highly flexible, easy-to-use cardiothoracic drainage and autotransfusion device. Depending on your hospital's preferred sampling technique, samples of drainage fluid can be taken directly from the patient tube by forming a temporary dependent loop and inserting a 20-gauge or smaller needle with syringe at a shallow angle. On selected models, samples can be taken directly from the needleless Luer lock sampling port located on the patient tube connector. At the heart of every Express chest drain is a state-of-the-art dry seal valve, which allows air from the patient to exit the chest and prevents air from returning to the patient. The Express graduated air leak monitor allows visual detection of air leaks from a low volume of 1 to a larger air leak volume of 5. Air bubbles passing through the graduated air leak monitor help the clinician assess air leak patterns and patient air leak trends. Continuous bubbling observed in the air leak monitor will confirm a persistent air leak in either the patient's thoracic cavity or possible tube connections. Intermittent bubbling with gentle float ball oscillation will confirm the presence of an intermittent air leak. And no bubbling with minimal float ball oscillation at the bottom of the air leak monitor indicates that no air leak is present. Bubbling from right to left in the air leak monitor must be present to confirm an active air leak. When vacuum is present in the collection chamber, a check mark will remain visible in the vacuum indicator window. When vacuum is not present, the check mark will not appear. All patient tube connections and the vacuum indicator should be checked regularly for vacuum confirmation. All Express models have an automatic high negativity release valve. This advanced valve design safely and automatically protects your patients against prolonged exposure to excessive negative pressures, which can accumulate as a result of repeat patient tube milking or stripping. To manually lower the height of the air leak monitor column when connected to suction, temporarily depress the filtered manual vent located on top of the drain until the blue water column lowers to the desired level. It is not recommended to depress the filtered manual vent when suction is not connected or not operating. When monitoring a patient's chest drainage system, it's important to periodically check the air leak monitor's operation and fluid level. If the air leak monitor is either underfilled or overfilled, it should be adjusted to the indicated fill line via the needleless Luer lock port on the back of the drain. In the event of an accidental knockover, upright the drain immediately and check the fluid levels. If required, the air leak monitor level may be adjusted using a Luer lock syringe. If a knockover does occur, fluid drainage can potentially spill from one collection column to another. If this occurs, gently tip the drain to the right to return fluid back to the correct column, and then upright the drain. The Express features an advanced air leak monitor design for maximum knockover protection, even when connected to suction. In the event of an accidental knockover, the knockover nozzles help minimize interchamber spillover for the ultimate in system reliability, user convenience, and patient safety. Most healthcare facilities routinely use suction as it helps improve the rate and flow of fluid drainage from the patient and out through the thoracic catheters. Suction also helps increase the rate and volume of airflow out of the patient to help maximize full lung expansion and stabilize breathing dynamics. Atrium's radial control suction regulator continually adjusts for changes in patient air leaks and fluctuations in hospital wall suction, providing the utmost in safety and reliability. The highly visible suction monitor bellows readily confirms suction operation in low light or from across the room. If the bellows is observed to be expanded but less than the delta mark, the suction source vacuum pressure must be increased to at least -80 millimeters of mercury or higher. For a regulator setting less than -20 centimeters of water, Any observed bellows expansion across the window will confirm suction operation. The bellows need not be expanded to the delta mark for suction pressures less than -20 centimeters of water, just visibly expanded in the window to confirm suction operation. For patient transport and gravity drainage applications, simply disconnect the suction source vacuum line from the suction port. As a safeguard against tension pneumothorax, a fully automatic positive pressure release valve opens instantly to release excessive accumulating positive pressure when such clinical conditions may arise. Its unique tamper-resistant design is located in an obstruction-free area on top of the drain. All Express models come equipped with a locking inline connector and patient tube clamp that provides convenient, simple disconnection after use, or rapid inline ATS blood bag attachment when required. The patient tube slide clamp must remain open at all times during system operation. It's recommended to position the patient tube clamp next to the inline connector for setup convenience and routine visual check. The patient tube clamp can be removed if desired. Handling and disposal of a discarded chest drain and its contents should be in accordance with all applicable regulations and approved hospital infection control standards.